Hi, welcome to today's discussion about a functional medicine approach to managing depression. In this video, you will learn about laboratory biomarkers, clinical findings that may appear on a nutritional physical exam, and evidence-based therapeutic considerations for holistically supporting an individual with depression. My name is Dr. Giovanni Nelson. I'm a licensed practicing naturopathic physician, clinical nutrition professor, and co-founder of the healing duo Integrative Family Medical Practice. Before we start talking about how to treat depression, it's important to discuss the pathophysiology of how depression even comes about. Enter the monoamine theory of depression. First described in the 1960s, this theory states that depression is at least in part caused by a deficiency of serotonin, dopamine, or norepinephrine within the central nervous system. This hypothesis is supported to some degree by the general success of antidepressant pharmaceuticals. The most studied neurotransmitter at this time is serotonin, or 5-HT, short for 5-hydroxytryptamine. But norepinephrine and dopamine are essential to optimal mental health function and nervous system function. Research scientists are still trying to put the pieces together to determine the actual cause of depression. This is because modern research has identified that the condition is multifactorial and may require a multidisciplinary approach to treatment. This is where functional medicine comes in. A functional medicine approach to an individual with depression will be different than a traditional approach because it's going to aim to identify which of the contributing factors apply to the client before adding therapeutic prescriptions. There's no better place to start this conversation than with some important single nucleotide polymorphisms, also known as SNPs. A genome-wide association meta-analysis showed that more than 20 genes are associated with depression. Let's start with methylene tetrahydrofolate reductase, MTHFR for short, and tryptophan hydroxylase 2 SNPs. The MTHFR gene is dependent on whether it is heterozygous or homozygous. Heterozygous carriers of the SNP experience a 20 to 40% loss of function in the enzyme, and homozygous carriers experience a whopping 40 to 70% loss of function. C677T MTHFR SNPs are prevalent and may be present in up to 20% of the general population. Tryptophan hydroxylase requires activated folate, or 5-MTHF, as a cofactor to function correctly. The MTHFR reductase enzyme is essential in creating activated folate in the body. Patients with a C677T SNP might have a decreased ability to create 5-MTHF, which reduces the amount of precursors ultimately available to make serotonin. Patients with an MTHFR mutation homozygous for TT have a 1.3 times increased risk of developing or being diagnosed with depression. Now, let's talk a little bit about tryptophan hydroxylase. Individuals with the SNP in the tryptophan hydroxylase 2 gene have a dysfunction at the rate-limiting step in the production of serotonin. This issue can produce a 80% loss of serotonin function when present. Supplementation with 5-MTHF, or activated folate, will be essential in these individuals because it will drive the reaction forward to the production of serotonin. Ideally, these cases will benefit from about 500 micrograms per day of activated folate. It's also beneficial to support the aromatic amino acid decarboxylase, or AADC enzyme, with activated vitamin B6, or P5P. This supplementation may also help to support the reaction going forward towards serotonin. As a general rule of thumb, vitamin B6 is a cofactor anytime you see a decarboxylase or a transaminase enzyme. Treatment with between 50 to 100 milligrams per day of activated B6 may provide some benefit in these cases. Next up, we'll talk about the big three: tyrosine hydroxylase, catecholamine O-methyltransferase, and monoamine oxidase SNPs. Individuals with the G334A SNP and tyrosine hydroxylase genes have a statistically significant increase in depression. Tyrosine hydroxylase is the enzyme responsible for the first step in producing dopamine, norepinephrine, and epinephrine. Deficiencies in tetrahydrobiopterin, for short, we'll just call this BH4, and iron will lead to an altered function of tyrosine hydroxylase enzymes because they are essential cofactors. This loss of function in enzymes is generally true in those with SNPs that decrease enzyme function. An important note here is that there's no specific BH4 supplement. You may be able to improve the levels of BH4 in the body by using some activated folate for its basically methyl groups that's on there. Now, individuals with increased activity in their monoamine oxidase or MAO enzymes due to SNPs may have higher incidences of depression. This is because the MAO enzymes are involved with the breakdown of all catecholamines. Increased activity leads to rapid breakdown and clearance of catecholamines from the central nervous system. The question you may be asking yourself now is, are there any natural agents that we can use to downregulate MAO activity? Well, there are actually several. So let's start with the bioflavonoid physteine. Now, this polyphenol is found in a wide variety of fruits and vegetables, and selectively has an inhibitory action on MAOA enzymes. Now, that's not the only one. Believe it or not, the flavonoid quercetin was also found to be one of the most potent inhibitors of MAOA enzymes. Active constituents luteolin and apigenin, found in a variety of herbs, also showed potential MAO inhibitory activities. Ginger polyphenols also have MAO inhibitory activity. 3 significant components of ginger were shown to inhibit MAOA enzymes. Now, it's not as strong as the prescription in that particular study, which was about 96%, but 40% gets us a little bit of the way there. Curcumin and L-gallic acid have MAOB inhibitory activity in both a competitive and non-competitive action. So these might be useful additions to your patient cases. Next, let's talk a little bit about COMT. Individuals with increased COMT activity have an increased risk of depression, especially when dealing with stressful life events. The gene SNP in question, MET, is associated with increased enzyme activity, which leads to a rapid breakdown and clearance of neurotransmitters from the central nervous system, similar to what we see with the MAOA enzymes or MAOB enzymes. What can we use to downregulate COMT enzyme function in the face of this ramped up expression? Scutellaria bicalensis root, which is a herb, contains an active constituent that has been shown to have potent inhibitory effects on enzyme function. Green tea polyphenols, epigallocatechin or EGCG, chlorogenic acid, and caffeic acid from coffee have strong inhibitory effects. Bioflavonoids quercetin and physteine also have some inhibitory capacity on the enzyme. The active constituent found in the Myrica rubra, or the Chinese bayberry fruit, appear to have some potent inhibitory effect against the COMT enzymes in a dose-dependent manner. Now, I could do an entire video, another separate one honestly, on different SNPs that have been identified to affect the pathophysiology of depression. So if you want to see a little bit more about the SNP conversation and some different things that you can use to support that, leave me a comment down below and we'll see if we can get a more detailed conversation about SNPs going. But with that, I think we covered enough SNPs for this discussion. Next up, let's talk a little bit about the amino acid testing and what you can find out through there. But before we get into the specifics of amino acid testing, it's important to understand that amino acid reserves are dynamic. Amino acid pools are capable of changing rapidly due to shifting rates of dozens of metabolic pathways. Physiological signals are often the catalyst. Amino acids can come from 2 sources: dietary intake and catabolism of body proteins. The measurement of amino acids in the blood, plasma, or urine may be able to identify individuals or patients who can be candidates for amino acid therapy. Individuals who have abnormal amino acids may indicate a loss of organ reserves in chronic disease states and resultant suboptimal function of the entire body. Amino acid utilization is time and tissue dependent. For example, while we're sleeping, the rate of melatonin synthesis in the brain increases. Simultaneously, many tissues are actively removing amino acids from the blood for tissue repair, neuron rewiring plasticity, and detoxification. The most important amino acids that we're going to be talking about regarding depression are phenylalanine, tyrosine, tryptophan, and gamma-aminobutyric acid, or GABA. Checking for plasma amino acids may be able to provide information on the amount of amino acids of interest present in the body. Although the amount of tryptophan in the serum may not be a direct indicator of the amount of tryptophan present in the brain, many amino acids tend to compete for transport into the brain, and tryptophan is often outcompeted by these other amino acids. So let's start this conversation by talking about both phenylalanine and tyrosine together. A metabolic block in the phenylalanine hydroxylase enzyme, sometimes we'll call it PAH, or individuals with one or more mutation in the phenylalanine hydroxylase gene may present with some issues. Mutations in the PAH gene may result in the condition called phenylketonuria. This condition is usually screened for in neonates, but carriers of the gene may also have some depressed enzyme function as well. This might look like an elevated phenylalanine and a depressed tyrosine on an amino acid test because you can't drive the reaction forward. A similar presentation may occur with a metabolic block due to a deficiency in the PAH enzyme cofactors. Deficiencies in vitamin B3, BH4 or tetrahydrobiopterin, and iron will lead to altered function of phenylalanine hydroxylase enzymes because they're essential cofactors. Typically here, treatment with L-tyrosine at about 500 milligrams twice per day for about 7 days is safe in these cases. Longer-term supplementation of L-tyrosine may result in side effects like nausea, headache, and fatigue. So beware of that and try not to push it for too long. I've seen some studies talk about safety for up to about 12 days, but I like to keep it about 7. Next, let's talk about tryptophan. Low serum tryptophan levels could indicate a low dietary intake, which could mean low or no precursors present to create serotonin. Typically, you could treat these cases with L-tryptophan at about 2 to 3 grams per day, combined with niacinamide at about 1 to 2 grams per day. Supplementation with niacinamide here increases the effectivity of L-tryptophan by inhibiting the enzyme tryptophan pyrrolase, which breaks down tryptophan in the liver. Typically, you want to take these in 2 divided doses, away from other protein meals, and with a small amount of carbohydrate to increase its absorption, typically in the brain. Now, you may also consider using L5-hydroxytryptophan, or 5-HTP, 150 milligrams to 300 milligrams 3 times per day. It usually produces sufficient therapeutic value. This form is often safer due to its inability to convert to quinolinic acid and Kynuric acid. We're going to discuss the importance of those two organic acids in the next section. Another important note about 5-HTP is that it has the ability to cross the blood-brain barrier easier without the competition of other amino acids. So some people prefer to use the 5-HTP because it can't really go anywhere else, and it can only really go in the brain faster. Next up is my all-time favorite amino acid, GABA. Low levels of GABA are common in individuals dealing with anxiety and depression together. A deficiency in vitamin B6 will lead to a decreased production in GABA and even lower the seizure threshold. Prolonged suppression of GABA levels can eventually damage the brain. Treatment here with GABA at about 200 milligrams per day for about 90 days should be enough to improve some of these findings. So next, we're going to move on and break down organic acid testing. Organic acid tests provide functional markers to determine defects that may indicate a biochemical pathway obstruction. When pathways are obstructed, intermediate organic acids accumulate and spill out into the urine. These findings can often point to nutrient insufficiencies or genetic SNPs. The results are better than direct plasma or blood vitamin concentration because of genetic SNPs that may warrant increased utilization of certain nutrients. Organic acid results accounts for the person's biochemical individuality. Some SNPs can change protein shape, which result in poor enzyme binding. Adjusting nutrient intakes can help stabilize the enzyme functions in these individuals. So the organic acid markers of interest include, specifically for depression, vinylmandylate or VMA, homovinylate, HVA, kynurenate or kyna, quinolinate, quin, picolinate, pico, and 5-hydroxyindole acetate, or 5-HIA. Urinary neurotransmitter concentrations should not be associated with any effects related to the actual effects in the brain or spinal cord neurons. So neurotransmitter tests are often not very useful. But looking at the organic acids can help with correlations between the central nervous system levels of those neurotransmitters. The first thing that we're going to discuss in terms of these organic acids are VMA and HVA. Low HVA and VMA is often correlated with low central nervous system levels of dopamine, norepinephrine, and epinephrine. Typically, you will see symptoms of depression, sleep disturbances, anxiety, and fatigue. Treatment here would look like tyrosine at about 500 milligrams twice per day for 7 days. Next, we're going to talk about 5-hydroxyindole acetic acid, or 5-HIAA. This organic acid is more likely to be lower in individuals diagnosed with depression. Treatment here might look like something with tryptophan or 5-hydroxytryptophan, 5-HTP, to help improve serotonin levels. Lower kynuric acid, or kyna levels, may be present in individuals with depression. That's because kyna is mostly neuroprotective. It functions by blocking NMDA receptors in the brain. NMDA is mostly the excitatory activity that occurs in the brain. Now, the problem with kyna is that if there's a B6 deficiency, it will lead to a downstream production of increased quinolinic acid. Higher quinolinic acid levels, or quin, are often associated and present in individuals with depression. That's because, unlike kyna, quin is neurotoxic and plays a role in the neuroimmunology pathway towards depression. It's not all about functional testing, though. There are some standard tests that can be beneficial too. So let's take a look at some of those. Thyroid disorders, both hypo and hyperthyroidism, may come with a wide range of neuropsychiatric dysfunction, including depression. Laboratory markers including a thyroid panel with TSH, free T3, free T4, and reverse T3. I like to look at reverse T3 because it may provide an insight into where the T4 thyroid hormone is going, especially when all the other thyroid tests look normal. Reverse T3 is non-functional and can become elevated in cases of selenium deficiency and severe illness. Antibodies, thyroid peroxidase, TPO, is commonly elevated in Hashimoto's thyroiditis. Thyroid stimulating immunoglobulin, or TSI, seen commonly elevated in Graves' disease. And thyroglobulin antibody, TGAB, which can be present in either of the autoimmune thyroid diseases. In cases of hypothyroidism, you can consider treating with Camiform mucil. This is also known as Google. A standardized extract of 2.5% glucosterones at about 500 to 1,000 milligrams 3 times per day can be extremely beneficial. Note that it might take up to 3 to 6 months in order for you to see those results actually happening. Google also may have some beneficial in individuals with hypercholesterolemia. So if you have a client or patient with high cholesterol and depression, Google might be your herb of choice. Now, the next lab test is very important because about 1 billion people worldwide and about 35% of adults in the US have a vitamin D deficiency, and about half of the world's population is insufficient in vitamin D. One study showed a significantly increased hazard ratio of depression in individuals with the lowest levels of vitamin D versus the highest. Check for levels of vitamin D with the 125 dihydroxyvitamin D marker, and usually you want to look for those in individuals with depression and support as necessary. Depression also seems to be associated with chronic, low-grade inflammatory response. The acute phase markers, C-reactive protein or CRP and ESR, are some of the most commonly used to measure inflammation in clinical practice. So CRP levels above 3 milligrams per liter are strongly correlated with depression, even in patients that don't have a chronic disease, believe it or not. ESR levels above 21 millimeters per hour may also contribute to depression findings. The evidence here is not as strong as the CRP findings, so I prefer to stick to the CRP results instead. Something that most people forget about entirely is the nutritional physical exam. So some research indicates that there may be an association between omega-3 included in the diet and decreased risk of developing depression. What are some signs of omega-3 fatty acid deficiency to look for on a physical exam? So you can see that the hair may be sparse and thin, If you see that and you're concerned about fatty acids, you can supplement linoleic acid specifically in these cases. A new onset of dry hair, hair loss, sudden and diffuse, dandruff or seborrhea, dry scaling skin, eczema, slow wound healing, acne, itchy ears, and dark cerumen. Sometimes dark cerumen may also be indicative of increased need for antioxidants, so some antioxidant support. You could consider some fat-soluble antioxidant support here. Something like vitamin E may be very helpful in this case. Typically, overall, you want to treat with fish oil. Omega-3s are the number of choice, or the omegas of choice. Typically, EPA and DHA at about 2,000 milligrams per day should get the job done in these cases. We already talked about how important vitamin B6 is in transaminase and decarboxylation reactions, but this mighty vitamin is involved in more than 140 biochemical reactions in the body. What are some signs of vitamin B6 deficiency to look for on a physical exam? So you'll also see some hair loss, sudden and diffuse as well. You'll see some tooth decay, and you'll see some peripheral neuropathy. So if you thought B6 was impressive, magnesium is involved in over 300 biochemical reactions in the body. What are some signs of magnesium deficiency that you might want to look out for on a physical exam? Typically, you might see some tachycardia, so fast heart rate, mitral valve prolapse, you'd see some constipation, tetany, bruxism, or that involuntary teeth grinding, palpitations, and usually support with magnesium at about 500 milligrams per day showed some significant improvement. And a wide variety of different types of magnesium that I saw in the study, there was about 4 types in the study, seemed to improve that magnesium deficiency and some of the symptoms that were present. So definitely worth including that. Zinc has been shown to interact with brain-derived neurotrophic factor, or BDNF. As BDNF decreases, the severity of depression increases. Zinc is necessary to keep BDNF levels optimal. So what are some signs of zinc deficiency to look for on a physical exam? So this one's pretty easy. You want to look out for leukonychia. So leukonychia are those white spots that you can see on the nail sometimes. They're very distinct from just a normal injury. They're usually very deep, and it's almost like a white line in the nail. So you want to keep an eye out for those as well. Very easy things that you can do on a physical exam, quickly looking at the patient and client to identify if any of these things are missing. One study showed that 25 milligrams of zinc together with an SSRI had a synergistic benefit and helped the depressive disorder more effectively. The study did have a small sample size of about 44, but it does indicate that there's some room for further study. The next thing that we want to keep an eye out for is look out for allergies. A large self-reported cross-sectional study with over 11,800 people showed that individuals in the 2 or more, 3 or more, and 4 or more group of allergens were more likely to be in the depressed group. So my favorite path to identifying food allergies is the gold standard elimination diet. Usually, though, I only recommend this path when dealing with highly motivated individuals because it is very time-consuming and can be difficult to complete. In individuals that are having a difficult time completing the elimination diet, and specifically in children as well, I would also recommend skin prick testing as well combined with serum IgE testing. That's because the skin prick testing alone is only about 50% accurate when positive. Combination with serum testing increases the likelihood of an allergy determination. There are no known treatments to treat or cure allergies at this time. I shouldn't say treat, but to cure allergies at this time. Typically, avoidance is the way forward. So you may want to also consider immunotherapy. Immunotherapy has the aim of developing tolerance over time, so you can use it as a treatment course of option. Now, the next big one is the microbiome. Several research articles have documented the connection between imbalanced microorganisms present in the gut and the onset as well as the progression of depression. Dysbiosis can disrupt the gut integrity, leading to increased production of pro-inflammatory cytokines. Dysbiotic organisms can also take tryptophan down the path to increase production of quinolinic acid and neuroinflammation. Stool microbiome tests can give specific breakdowns about organisms of interest to the gut-brain axis and some important microbiota-derived metabolites. One such important group of metabolites are called short-chain fatty acids. Typically, that group includes acetate, butyrate, and propionate. They do tend to be depleted in patients that have depression. Butyrate is especially useful at decreasing intestinal permeability in the colonocytes. This can decrease the HPA axis reactivity and improve depression. Several studies have identified an increase in Eggerichia, Atopium, and Bacteroides, with a decrease in Faecalibacterium, Akkermansia, Bifidobacterium, and Lactobacillus in depressed patients. The Faecalibacterium is the main component of butyrate-producing bacteria in the guts. Now, supplementation of probiotics with prebiotics can produce profound effects. One study showed that a combination of Lactobacillus acidophilus strain T16 with Bifidobacterium bifidum strain BIA6, Bifidobacterium lactis strain BIA7, and Bifidobacterium longum strain BIA8 in combination with fructooligosaccharides, galactooligosaccharides, and inulin improved depression scores and increased serum levels of brain-derived neurotrophic factors in patients with depression. So that is a wonderful combination of some pretty standard probiotics that can be used with prebiotics to help improve symptomatology in individuals suffering with depression. And what about therapy? Cognitive behavioral therapy, or CBT, is an effective first-line treatment for depression. At the heart of CBT is an assumption that a person's mood is directly related to his or her patterns of thought. Negative, dysfunctional thinking affects a person's mood, sense of self, behavior, and even the physical state. It may be worth incorporating this form of therapy into the treatment plan to help reframe the patterns of thought. Understanding and managing depression requires a comprehensive approach that integrates insights from both traditional and functional medicine. Remember, the pathophysiology of depression is complex and multifactorial, involving genetic, biochemical, and nutritional factors. The monoamine theory of depression highlights the role of neurotransmitter deficiencies, but modern-day research underscores the need for a multidisciplinary approach to treatment. Genetic considerations such as SNPs in MTHFR, tryptophan hydroxylase 2, tyrosine hydroxylase, MAO, and COMT all provide valuable insights into the biochemical imbalances that may contribute to depression. Addressing these imbalances throughout targeted nutritional and supplementation strategies, including activated folate, 5-MTHF, vitamin B6, P5P, and essential amino acids like phenylalanine, tyrosine, tryptophan, and GABA, can support neurotransmitter synthesis and improve overall mental health. Laboratory biomarkers and testing play a crucial role in identifying the underlying issues. Comprehensive thyroid panels, vitamin D levels, inflammatory markers, CRP and ESR, and organic acid testing may help pinpoint biochemical imbalances and nutrient deficiencies that may be contributing to the depressive symptoms. A thorough nutritional physical exam can help to reveal signs of deficiencies like omega-3 fatty acids, B6, magnesium, and zinc, all of which are vital for optimal brain function. Additionally, addressing gut health through the gut-brain axis by balancing the microbiota with probiotics and prebiotics can significantly impact mental well-being. Therapeutically, cognitive behavioral therapy remains an effective first-line treatment, helping individuals change negative thinking patterns that affect their mood and their behavior. Now, combining cognitive behavioral therapy with functional medicine approaches provides a holistic and personalized treatment plan that addresses not only the symptoms but the root cause of depression. By integrating those genetic insights, nutritional therapies, and traditional treatments, we can offer a more comprehensive, effective approach to managing depression, ultimately improving the quality of life for those affected by this condition. I want to thank you for joining me on exploring these vital aspects of mental health, and I look forward to seeing you at the next video. Thanks.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.